there's one over here.
Tim Reeves is a retired teacher, a father of 3 who's been married to his wife for nearly 50 years.
Those are nice. Okay, I'll take those in.
But it was 18 years ago that he got the diagnosis that would change his life: metastatic prostate cancer.
I was not able to have it surgically removed. They'd had to go all over my body.
3 rounds of chemo failed to rid the cancer and left him with a slew of health problems. At age 67, he tried marijuana for the very first time.
I don't know what the answer is for other people, but I know it's worked for me.
Oncology, radiation oncology.
Reeves got the go-ahead from his oncologist, Dr. Annette Fontaine, who says she prescribes cannabis to about 1 in 20 of her cancer patients.
The medical marijuana helps with their appetite so they can maintain their nutrition during treatment. They're having significant fatigue, having significant nausea. These are the patients that benefit the most.
Fontaine says she used to prescribe the marijuana derivative Marinol before the full cannabis plant was legalized for medicine. It's a drug that's currently available in Arkansas, but she says the impact is not the same.
I would say that there are benefits with medical marijuana that is not available with Marinol.
The future of Arkansas.
Marijuana is grown by 35 providers in New Mexico. This operation just outside Albuquerque, owned by a company called Ultra Health, is one of the most advanced. People with a government-issued license can buy a variety of marijuana products at dispensaries across the state.
Antibiotic ointment at home.
But it's not just cancer patients. New Mexico doctors say they've also seen benefits for those with chronic pain, autoimmune and inflammatory diseases, and that it's been a big help to children suffering from epileptic seizures.
Doctors make difficult decisions in managing patients every day, all the time. And yes, I think, the community can trust the physician to do the right thing and prescribe it for the patient that would benefit.
At night, they don't like a bright flashlight.
Tim Reeves says he's one of those patients. He says his health and spirit have improved since he began using medical marijuana.
It needs to be legalized and made an honorable thing that's just like any other medicine.
If you don't have a medical marijuana card, there can be a civil violation for that.
Lieutenant Michelle Williams has been with the Santa Fe Police Department for 15 years.
This corridor, pretty much for the most part in graveyard hours, is a lot busier.
Her stint spans both the time before and after medical marijuana was legalized in New Mexico.
Have you seen an impact?
A little bit, yeah, I would say so.
For one, she says dispensaries that sell marijuana have been burglarized and robbed.
They have become somewhat of an easy target just because of the advertisement of what clearly is in the facility.
But when it comes to drug dealing and abuse, she says there's been no impact. Another area of concern, calls to the Poison Center for marijuana exposures. They've increased 50% in the 8 years after medical marijuana was legalized compared to the 8 years before. While there have been no deaths, the largest group impacted is teens aged 13 to 19, some of whom have been hospitalized.
Obviously, the use or access to the product from adolescents is a huge concern.
75% of the 31,000 people currently enrolled in the New Mexico program are diagnosed with PTSD or chronic pain. They are difficult conditions for doctors to verify, leading some to speculate people are gaming the system.
The more cynical side of us probably would, but the way we look at it is these are folks that have a certified diagnosis from a licensed medical practitioner.
I get it. There are people that are very scared. I was.
Darren White is an Army vet who spent 30 years in law enforcement, including 7 as sheriff of Bernalillo County, which includes Albuquerque. During the push to legalize medical marijuana, he was opposed.
I just wasn't convinced that it was at that level yet where it could be just used medicinally. These other options, these are hard candies, lollipops, right down to kind of the specialty bonbon.
Now he's on the board of a nonprofit that grows and sells it, won over during his struggle during pain from injuries he received on the job.
It's a very good alternative to just a steady diet of painkillers. I can't even explain how much better it is.
Maze. Maze with an S though, right?
Lieutenant Williams says overall, legalizing medical marijuana has made the job of policing easier and more effective, allowing officers to focus their efforts on more serious problems.
The things that really capture our attention and really monopolize our time are the things like heroin and meth, where people are dying over it.
This is the largest cultivation for commercial cannabis in the state.
Leonard Salgado is vice president for business development at Ultra Health, a company specializing in the production and distribution of medical marijuana.
That's what you're looking for, the actual terpenes, the frosting of the plant.
On 11 acres of land just outside Albuquerque, Ultra Health is growing 450 plants of varying sizes, strains, and colors.
In order to maximize yields, some plants are allowed to grow under natural sunlight. The process takes much longer, but the plants, they get much bigger. This one right here is almost ready for harvest. It's sticky and you can sure smell it. The plant is so big, the yield could be up to 8 pounds.
This one's going to be at about 18% THC.
Probably have to be careful with that one.
Yeah.
That's about $40,000 when sold by the gram at the 6 dispensaries Ultra Health operates. In all, the company employs 60 people in New Mexico. Salgado says it's evidence of the economic power of medical pot.
We are a $45 million industry in this state today.
But not everyone agrees cannabis is good for the state's economy.
Business Association representing businesses both big and small.
Jason Espinosa is president and CEO of the New Mexico Association of Commerce and Industry.
There was a lot of unintended consequences. One of the issues that it's really caused havoc in is workers' compensation.
State legalization and subsequent court rulings now force employers to pay for the medical marijuana of employees on workers' comp, even though the drug remains illegal according to federal law.
So what do New Mexico businesses do? Do they follow the New Mexico court order and break federal law? Or do they follow the feds and break New Mexico law?
But proponents say the industry is growing and benefiting the state. Since 2014, sales tax from medical marijuana has pumped nearly $5 million into state coffers, a number that's growing at a time when New Mexico is facing huge budget deficits.
Think about the benefits economically that it can bring to your state.
But Espinosa urges caution. He says chasing green doesn't always pay off.
If it's negatively going to impact the employers in certain ways it has here in New Mexico, that is going to disadvantage you in job creation and business investment and hurt the economy moving forward.
Let's fix your hair real quick.
Amelia Nunez is 10 months old and the youngest medical marijuana patient in New Mexico.
Baby mama, fix it.
She had her first seizure just 4 days after she was born.
We were in the hospital like 2 days after is when they diagnosed her with epilepsy.
Amelia was put on a regimen of prescription meds, but her mother, Nicole Sena, says the seizures didn't stop.
She was having one about every 30 minutes.
Doctors said they could eventually kill her, so Nicole decided to try something new. 3 times a day, she gives Amelia CBD oil. It's a non-psychoactive marijuana extract.
We just completed 7 months yesterday of being seizure-free. If it wasn't for trying cannabis, I would have pretty much a lifeless baby.
It's stories like these that medical marijuana advocates in Arkansas point to as they push for a change in the law. But legal cannabis in New Mexico has impacted more than the lives of patients.
Torrance 1 dispatch, I'll be clear my last.
Heath White is a county sheriff and president of the New Mexico Sheriff's Association. He says drug cartels have infiltrated the medical marijuana business.
They'll have someone who has applied legally to grow marijuana for that purpose, and then after they get established, they come in and pretty much strong-arm them.
He says privacy laws meant to protect patients make it difficult to decipher between legal and illegal growing. Some
law enforcement officers or agencies have gone in with search warrants and all the good intentions, but ended up being in lawsuits.
And he says easy access to medical cannabis cards make it simple for New Mexicans to get pot for recreational use.
Back alley doctors who will come into New Mexico, write hundreds and hundreds of prescriptions for a person to use medical marijuana when they don't have any symptoms at all.
Nearly every person we found on the streets told us life hasn't much changed since medical cannabis was legalized, though some say regulations should be tightened to keep people from exploiting the system.
I have a family member who has cancer. I know firsthand that there is a purpose for medical marijuana.
Even Sheriff White was hesitant to say he'd undo the change that happened here, but he urges Arkansas policymakers to work closely with law enforcement if medical marijuana passes.
I thank God every day for it.
Because of its impact on her daughter, Nicole Sena has become a passionate medical marijuana advocate. She hopes Arkansans will follow the lead of New Mexico and other states when they head into the voting booth.
It saved my daughter's life, and it could save millions of other people's lives